Okay, guys, so today we're going to go over the muscles of the appendicular side of things. So again, this is going to follow the bones of the appendicular skeleton and be the points of attachment on those structures. So the job of the appendicular muscles is to position and stabilize the pectoral, which is your shoulder joint, the pectoral girdle, and the pelvic girdle, which is your hip joint. These muscles will also help to move and move the upper and lower limbs of the body. And there are two groups of appendicular muscles, the muscles of the shoulders and upper limbs, and the muscles of the pelvis and the lower limbs. So again, this is that same figure that we saw yesterday with the superficial muscles. Again, this is an image that you should be able to identify all the muscles on these particular figures of both the anterior and posterior views. So the muscles of the shoulder and upper limbs, there are four groups. There are those that are going to position the pectoral girdle, muscles that'll move the arm, muscles that'll move the forearm and the hands, and then finally muscles that'll move the fingers. So one of the major muscles that positions the pectoral girdle is the trapezius muscle. This is large and it is superficial. It covers back and portions of the neck. It will extend to the base of the skull, and it originates on the midline of the neck and the back, and it will insert on the clavicles and the scapular spines. And this is the trapezius muscle here. Again, it's a very large muscle. You can see it attaches here at the base of the skull. It's going to insert on the scapular spines and the clavicle, okay? And it also has this tendon attachment down the back and neck region. Another major muscle that's involved in helping to secure the pectoral girdle is the serratus anterior. This is a fan-shaped muscle that's located on the anterior side of the chest. It originates along the ribs, and it will actually insert on the anterior margins of the scapula. You also have the subclavius, which will also originate on the ribs and insert on the clavicle, and the Pec Minor, also originating on the ribs, but this will actually attach to the coracoid process of the scapula. So looking here, you can see, again, this is our trapezius here, okay? Here's the subclavius, just below the clavicle bone there. The Pec Minor is here. Now, if you remember, we had the Pec Major, which we talked about earlier on the thoracic cavity, thoracic muscles here. But the Pec Minor is actually going to be deep to the Pec Major, okay, which is cut in this diagram. And then here you can see the Pec Minor again, but then we have our serratus anterior muscles, which are attached to the ribs right here, and they sort of wrap around. Additional muscles that are going to help to anchor the pectoral girdle are going to be your rhomboids, major and minor, and the levator scapulae. They are deep to the trapezius, okay? They will attach to the cervical and the thoracic vertebrae, and they will also insert on the vertebral border of each scapula. So here's your levator scapulae, and if you look right here, you can see it's attached in the border of the scapula right here. And then we have our rhomboids here and here, which are going to attach to the back. Again, both the levator scapula and the two rhomboids are going to be deep to the trapezius, which would be superficial to these guys. Okay, so muscles that move the arm. We have the deltoid. This is going to be your major abductor. And again, abduction would be movement away from the midline. And then you're going to have your supraspinatus, which would be a synergistic muscle for the deltoid, and it would assist the deltoid. So here is your deltoid muscle right here. And what you could just see the point of attachment right here, right? So picture these fibers contracting, and they're going to shorten up. They're going to pull the arm out this way, okay, which again is abduction. Here's the supraspinatus. The supraspinatus is just a synergistic muscle for the deltoid. It helps stabilize that action. Muscles that move the arm include also the subscapularis and teres major. These will actually produce medial rotation at the shoulder. The infraspinatus and teres minor, which will produce lateral rotation at the shoulder. And the coracobrachialis, which will produce flexion and adduction at the shoulder. So here's the subscapularis again. All right, but here's your coracobrachialis right here. Teres major, okay. And then if we remove the subscapularis, we cut that away, you'll see the supraspinatus, infraspinatus, and the teres major, and these are all part of what we call your rotator cuff muscles. The pec major, this is between the anterior chest and the greater tubercle of the humerus. This will produce flexion at the shoulder joints. And then you have the latissimus dorsi. This is located between the thoracic vertebrae and the humerus. This will also produce extension at the shoulder joints. So here's your pec major. Okay, we had seen an image before where this was cut away. And you have the pec minor below there, as well as the infra. Sorry, the pec minor, which is below this. And then here's the deltoid. Okay. Again, here now we cut away the pec major. All right, but what you're seeing here, this huge muscle attaching in the back here, your lower back area, is the latissimus dorsi. Okay. So your rotator cuff, the muscles that are involved in shoulder rotation, and just imagine the full free range of motion that your shoulder actually has. The muscles involved in the rotator cuff are the supraspinatus, infraspinatus, teres minor, subscapularis, and all of their associated tendons. Okay, so moving down a little bit, muscles that move the forearm and the hand. Most of these muscles are going to originate on the humerus. And insert on the forearm and the wrist. Exceptions to this would be the major flexors, which are the biceps brachii, and your major extensor, which is a triceps. So make sure that you guys are aware that your flexor of the forearm is your biceps, and most people know that because when they tell you flex your arm, show your biceps, right? And then the major extensor, which is going to be the antagonist to the biceps, is going to be your triceps muscle. Both the biceps and the triceps brachii will originate on the scapula as well. The extensors of the elbow, the triceps are going to be involved with this. So looking here in the arm, here you can see your triceps, all right? So again, these are going to extend the arm. And then if we look in an anterior view, you'll be able to see the biceps, which is right here, the biceps brachii on the anterior view. So anterior view, you'd see your biceps, posterior view, you would see your triceps. Some synergistic muscles that work with the biceps is the brachialis and the brachioradialis. And they will also help to flex the elbow. And again, here's the biceps. The brachialis is going to be deep to the biceps, and the brachioradialis is going to be here in the forearm. Oops, sorry. Supination and pronation. So supination is going to be when you have your arms in anterior position, an anatomical position, the anterior view of your arms. It's going to be palms up, okay? And pronation would be palms down. So the supinator and the pronator teres, these are going to rotate the radius, and they will originate on the humerus and the ulnar. The Pronator Quadratus, this will originate on the ulnar, and this will actually be synergistic with the Pronator teres, and it also helps to oppose the actions of the biceps brachii. Here is your supinator muscle right here. Again, look at the fibers. When this contracts, it's going to kind of pull your arm in a rotation where your palm up. And then if you look at the Pronator teres here, and the Pronator Quadratus, look at the arrangement of these fibers. When these guys contract, they're going to pull the rotation of the arm so that your palm's down. And here you can see pronation versus supination. Flexors of the wrist. These are actually easy because they actually have flexor right in the name. You have the flexor carpi ulnaris, flexor carpi radialis, and palmaris longus. These are all going to flex the wrist. Okay, so the flexors are actually going to be in the anterior compartment of the forearm here. And when these guys contract, again, they're going to pull that wrist upwards. Your extensors of the wrist, you have the extensor carpi radialis and the extensor carpi ulnaris. And these are going to be involved in extension, and they are in the posterior compartment. So with movement of the wrist, your anterior compartment, meaning an anatomical position your arms in anterior anatomical position. Those are going to be your flexors. On the posterior compartment of the posterior side, that's going to be your extensors. There are lots of tendons in the forearm muscles that cross the wrist and pass through the synovial tendon sheaths. And the extensor reticulum, this is actually a wide band of connective tissue. It's actually on the posterior surface of the wrist, and it's really there to help stabilize all the extensor muscles. And then you also have a flexor reticulum. This is on the anterior surface of the wrist, and this will stabilize the tendons of the flexor muscles. And here's the extensor, and then the flexor right here. And again, this is just a band of connective tissue that's really there to help stabilize the tendons and points of attachment. Muscles that move the fingers, you have your extrinsic muscles of the hand. They're going to lie in the forearm. Only tendons will cross the wrist, and this will provide strength and gross movement of the hand and the fingers. Okay. And again, in the anterior compartment, you're going to have all of your flexors. Don't worry about the individual flexor muscles involving the fingers. Again, here's more, you can see different layers of the flexors. And here's the middle layer and the deepest layer. Okay. Sorry guys. So the anterior view is your flexors. Here's the middle and deep layer. Your posterior view is going to be your extensors. Here's the middle layer and the deep layer. Okay. So again, all I want you guys to know is for flexion of the fingers, those would be the muscles in the anterior compartment. For extension of the fingers, those would be the muscles in the posterior compartment. The fingers are also going to have intrinsic muscles. These will originate on the carpal and metacarpal bones. No muscles actually originate on the phalanges. Only tendons extend across the distal joints of the fingers. And it's actually these intrinsic muscles that are going to provide the fine motor movements that we see in the hand. And there are several layers to these as well. So this is looking at anterior palmar view. And here is a posterior view. And that is it for the upper limb. The muscles of the lower limbs. The pelvic girdle is tightly bound to the axial skeleton. And remember that this is the point of attachment for your legs. Just imagine the stress, the pressure, weight that's put on that. The pelvic girdle actually permits little movement. Few axial muscles will influence the position of the pelvis. It also provides a range of movements that is possible for the lower limbs. So the actual pelvic girdle doesn't have much movement, but the lower limbs obviously do. So muscles that position the lower limbs, there are three functional groups: muscles that move the thigh, muscles that move the leg, and then muscles that move the foot and toes. So let's talk about the thigh first. You have your gluteal muscles, such as the gluteus maximus, medius, and minimus. Your lateral rotators, your adductors, and the iliopsoas. So the gluteal muscles, you have your gluteus maximus. This is the largest and most posterior gluteal muscle. It produces extension and lateral rotation at the hip. The tensa fascia lata, which works with the gluteus maximus, so it's a synergistic muscle for the gluteus maximus. And this will pull on the iliotibial tract of the lateral surface of the thigh. The gluteus medius and gluteus minimus, these are going to originate anterior to the gluteus maximus, and they will also insert on the greater trochanter of the femur. So looking here, we can see our gluteus maximus, our gluteus medius, and then the deepest layer would be the gluteus minimus. Here you can see the gluteus maximus, gluteus medius. Here's the tensa fascia lata right here. Okay, so again, this helps to stabilize this muscle here. Here you can see the three glutes. Okay. So your adductor muscles will include the pectineus, adductor brevis, longus, and gracilis muscle. These are going to actually produce hip flexion and adduction. The adductor magnus, this will produce adduction and extension or flexion. It is also going to provide medial and lateral rotation of the hip. The iliopsoas muscle, these are your two hip flexors that will insert to the same tendon. And the two muscles that form the iliopsoas are the psoas major and the iliacus. So here's your adductor group, and again, adduction is moving the limb towards the midline. So picture all of these muscles in the adductor group here contracting. They're going to pull this leg towards the midline. Okay. The iliopsoas group here, you can see this is the psoas major, and then the iliacus muscle right here. Muscles that move the leg, you have your flexors of the knee. These are actually going to originate on the edge of the pelvis, and they will insert on the tibia and the fibula. Your knee extensors, these are going to actually originate on the shaft of the femur, and they will insert on the patella. So your flexors are going to include your hamstrings, the sartorius, and the popliteus. And your hamstrings are going to be composed of the biceps femoris, semitendinosus, excuse me, and semimembranosus. Okay, so these are your flexors at the knee here. Okay, and what they're going to do is they're going to allow you to flex the knee, which is sort of bending at the knee. They're going to be on the posterior side. And the ones that are indicated in the hamstrings, which is your biceps femoris, semitendinosus, and semimembranosus, they're indicated here with the little asterisks. And then you have your sartorius and popliteus muscle. Your knee extensors are going to be your quadriceps femoris, and this will consist of the three vastus muscles: vastus lateralis, vastus intermedialis, and vastus medialis, as well as the rectus femoris muscle. So the extensor group is actually going to be on the anterior surface here, okay? We have our rectus femoris right here. And you have your vastus lateralis, which is going to be on the lateral side, vastus medialis on the medial side. And if you actually remove the rectus femoris muscle, you'll see the vastus intermedialis. Which you can sort of see right here. So here's the rectus femoris muscle. This is the vastus lateralis, vastus medialis, and then here's the vastus intermedialis right there. Muscles that move the foot and toes, the intrinsic muscles that produce the plantar flexion. Plantar flexion is on your tippy toes. This is going to be the gastrocnemius, which is your calf muscle, soleus, fibularis muscles, and the tibialis posterior. And you're also going to have the calcanean tendon, also referred to as your Achilles tendon, which is going to be shared by the gastrocnemius and the soleus muscles. So again, the ankle extensors, this is going to include the plantaris, gastrocnemius, your calf muscle here, and the soleus, and this is your Achilles tendon right here. Okay, yeah. And again, when these muscles contract, they're going to allow you to stand on your tippy toes. Flexion at the ankle. This is going to include the tibialis anterior. The tibialis anterior is going to be antagonistic to the gastrocnemius. Extrinsic muscles that produce extension at the toes. These are going to be your extensor muscles, such as the extensor digitorum longus, extensor hallucis longus. And your extensor muscles are actually going to be on the anterior compartment, and they will help to extend the toes, okay? This is a little opposite than what we saw in the fingers. Remember, in the arm, your anterior compartment is going to be the flexors, not the extensors. But on the foot, the anterior compartment is going to contain your extensors. Just think about the movement of your fingers and your toes. Okay. So, flexion at the toes, this would be the posterior compartment. This would include things like the flexor digitorum longus and the flexor hallucis longus. And again, just know what the compartments. So again, posterior compartment's going to be flexion, anterior compartment's going to be extension, opposite in the arm. But don't worry about the individual muscles for the toes there. Okay. Much like we saw in the hand, we're going to have intrinsic muscles of the foot. These will originate on the tarsal and metatarsal bones. They will move toes and maintain the longitudinal foot arch. And there are several layers of these intrinsic muscles that are going to help to support the arch of the foot, but also help to maintain movement in the toes, the fine movements in the toes. And you have, superficial layer, deep layer, and there are quite a few muscles involved there. Again, you don't need to know any of those individual muscles. Okay, and that is it for the muscular system. When you're studying this for the lecture exam, you want to know the muscles and their functions. I'm not going to ask you any origins and insertions. Like I said, if you're going to PT school, that would be something that you would eventually need to know. but for this course, I'm not going to ask you that. For the identification, it would just be the figures that are listed in the atlas, and that is straight up identification. Okay, so, just try and make this as simple as possible. I know I have you guys working on that assignment where you are, identifying all of the functions for the muscles. I will post my answer sheet to that once the assignment closes, so that you can go back and check those answers. But that study guide or that assignment sheet that you create is really going to be your main study guide for this lecture exam for Chapter 11. Okay, and then you have Chapter 10, which was all of physiology. All right, have a good day, guys.